Hi, my name is Brandt and I'm a general surgeon. We're talking today about umbilical hernias that either you or your primary care physician is concerned that you might have. When we talk about umbilical hernias, it's important to understand that a hernia itself is simply a hole or a defect in your abdominal wall. In the case of an umbilical hernia, this is something you probably had your entire life. When you were a baby in mommy's tummy, your umbilical cord is what supplied you with all the nutrients you needed to grow. After you were born and that umbilical cord was cut, that hole in your abdominal wall should close up completely. However, on occasion, we're left with a tiny hole that can get bigger over time until it's large enough to where tissue from the inside of your abdomen can bulge to the outside. That can be painful on occasion. When talking about an umbilical hernia or a defect in your abdominal wall, in order to fix that, we start by making an incision around half of your belly button, usually in a smiley face type fashion. We dissect down to the defect and we can either close it with stitches on its own, or we can place a piece of mesh on the inside of your abdomen, fixate that mesh in at least 4 quadrants with sutures, and then close the defect over top of the mesh, also with permanent stitches. We then close the skin with stitches that will dissolve on their own on the inside and glue on the outside. It is a same-day surgery. You come in, you have surgery, you go home the same day. Recovery is about 2 to 6 weeks. The first 2 weeks, you'll be sore from the surgery and your incision will be healing. 2 to 6 weeks, we do recommend activity and lifting restrictions, as it does take time for your scar tissue to incorporate that mesh into your abdominal wall. The literature says that it takes about 6 weeks for our scar tissue to be roughly 80% as strong as it ever will be, and therefore we do recommend activity restrictions for up to that point. If you have any questions or would like to discuss a repair of your umbilical hernia further, please feel free to schedule an appointment with me at your convenience. Thank you.